Once again, we're going to talk about endometriosis. I'm Dr. Tani Ping, a consultant obstetrician and gynecologist. Thank you for staying tuned. For those of you who have missed previous videos, please go to my YouTube channel. My link is in this video. Just click onto the link, go to my YouTube channel, look at the previous videos, and remember to subscribe to my YouTube channel and also click on to the notification button. Okay. Traditionally, that is the advice you get from a lot of doctors. What happens in the past is that, in the past, there are very little option, okay? Vicin was not available at that time. Vicin is a very new medication. It's only probably in this world 5 to 10 years ago. And we know every other drug has too much a side effect, cannot take long term. Lucrin 6 months the most. Lucrin we take 6 months the most. Zoladex 6 months, Danazol also 6 months. Their side effects is so much that it cannot be taken long term. But endometriosis is a long-term disease. Also, we only have surgery. And we also know that a lot of times, even if we do surgery, like now, when they do surgery, they just remove the cyst, remove the adenomyosis, and then leave everything else behind. You have endometriosis of the urethra, the bowel, the bladder. As a result, a lot of women go through multiple surgery because a lot of disease is still left behind. So the disease comes back very fast and the pain comes back and you need to do surgery again and again and again. That is why traditionally, what we do with endometriosis women is very simple. Just remove the uterus and the ovary. The key between about removing the uterus is you must remove the ovaries. You cannot just remove the uterus without the ovary. Because when you remove the uterus without the ovary, then there is still ovary that will stimulate the endometriosis that are everywhere else. But let's say if you remove your uterus plus the ovary, then of course your endometriosis will not be active anymore. But question is, are you going to continue like this? Are you going to be on hormone replacement therapy to prevent old age diseases? Or are you just going to let your body age? So both ways also no good. Let's say if you do not want to go on any hormone replacement therapy, then you're going to age faster. Women without ovaries have a shorter lifespan. Why do they have a shorter lifespan? Because all the old age disease comes in faster, so you die faster, that's it. So maybe you don't care, maybe I die faster is fine, no point living so long. Yeah, maybe you say that, but it's not just that, it's the other sufferings that you have to go through due to aging. Let's say women who have menopause in their 50s only have a lot of problem walking and going around in their 70s. But if let's say you menopause in your 40s, then you're going to feel the same thing, all these problems with your pain and unable to walk, backache, knee pain, and all those pain in your 60s. So are you okay in your 60s? People in your 60s, you'll be seeing your other friends in their 60s still very active, can work. Their memory is still good because they can work. They can still move around, no pain, nothing. So it's the quality of life that we're thinking. I always feel that you should keep the ovary for your old age because women need to have quality of life. The question is how we're going to settle the pain from now until the menopause. That's why the key is, as I mentioned, the complete endometriosis treatment that I mentioned again and again in all my videos. So don't leave diseases behind on your bowel and your rectum and everything. So we need to think about that, and then we need to think about the medical treatment after that. We do not stop medical treatment. Because maybe even I think that I remove 100% of the disease, but some of the disease, some of the endometriosis cells may be already in your bloodstream. What about those that are going somewhere else after the surgery? So that's another thing. And the complementary treatment. Yes. So I hope I answered these questions. My answer would be so simple. Are you removing your uterus only? Then the answer is no point. If you want to remove your uterus, you make sure you remove your uterus plus your ovary. If you want to remove your uterus, make sure, and also all the other endometriosis, leave behind your ovary, go on medical treatment until you menopause, and the complementary therapy that I mentioned, which means that you still need to go for dietary changes, you still need to manage your stress, your emotions, and also you need to go for physiotherapy. So removing uterus and ovary, yes, that solves your problem, but you're going to age. You have to ask yourself whether that is something you can accept. Is that something you can accept? That's all for today. So put in all your questions in the comment section and I will see you again. Thank you and bye-bye.